Phase 2 of the state's vaccination plan is underway, so that means more of you will know someone who has received at least one dose of the COVID-19 vaccine. So here to answer our questions is Dr. Todd Ellerin tonight, Chief of Infectious Diseases at South Shore Health. It's great to see you, Doc, as always. People 75 and older became eligible for the shots at the beginning of the week, the beginning of the month. So we expect more people will have sore arms today. So I want to boil down on that. Are there any side effects from the vaccines that patients should say, that raises a red flag, and call their doctor about?
Right. So the first thing I want to say is it's interesting. The older you are, the less side effects that are reported. The bottom line is the elderly are tougher than we are when we're younger. So that's good news. But of course, we expect most of the reactogenicity, the redness, the swelling, pain at the injection site, most of that resolves within 36 hours. If you have continuing symptoms beyond that, you want to call your provider. If you have fevers that last more than 48 to 72 hours, call your provider. Of course, any respiratory symptoms, shortness of breath, that's not associated with the vaccine typically. You want to call your provider.
So what if you don't have any side effects after either dose? Does that mean that your immune response is lower and that you're less protected?
Maria, I've been asked that a number of times, and the answer is absolutely not. We think that most people, whether they have significant side effects or no side effects, mount a very robust antibody response. So if you've had no side effects, you're lucky.
So, Dr. Ellerin, you've talked a lot about your concerns with the new variants of the virus. What's the risk that they could infect someone who has been vaccinated, or even perhaps reinfect someone who's already recovered?
Right. These variants are complicated. The best things we can do is crush the virus so it replicates less and we see less variants. What we do know is, especially with the South African variant, is that people that have been infected before with the original variant have been infected with this. So it looks like natural immunity doesn't necessarily take care of the variants. But we do think that vaccination, while it may not be, perfectly optimal, still is the best chance of reducing your likelihood of getting variants. More to come in this real-world experiment.
Right.
It's been 1 year now since the state here identified its first case of the novel coronavirus. So we weren't even calling it COVID-19 then, 1 year ago. As you sit here today, what's your best guess at where we're going to be with this pandemic 1 year from now? I know it's hard to do, but if you could look ahead.
Maria, I think we're going to be in a much better place. I do think that once the general population is vaccinated, that it's really going to reduce the amount of transmission and it's going to put us in a better place. The one caveat is we really have to understand the variants more. So we have to see, is COVID-19 really going to go away? Can we reach herd immunity? Or are these variants going to make it more like influenza? Remember, with the flu, we don't talk about herd immunity because the mutations haven't come back each year. But I think these vaccines, remember, all of the vaccines, those approved and not approved, have shown so far that they reduce severe infection. So if you can reduce hospitalization and death, that's really the key.
It is so true what you just said, Dr. Ellerin. We are learning as we go along, each step of the time. We're learning every minute of every day something new.
This virus has really taught us to not just rest on our laurels, to keep studying it, and to make sure that we care about each other. That's key. And make sure we protect each other while we're getting vaccinated.
Dr. Ellerin, it's great to talk with you. Thank you so much.
Thanks, Doctor. Be well.
Take care, guys.